my name is Serenity Vogler, and today I'm going to be demonstrating how to do a central line dressing change on this mannequin here. Before I go into the patient's room, I would gather all of my supplies and check the MAR for an order to do this dressing change. And then as I go in the patient's room, I will knock and introduce myself. Hi, my name is Serenity, and I'm going to be your nurse today. And I would explain to the patient the procedure, that I'm going to be changing his central line dressing, and that this is a sterile procedure. And if he had any family members in the room, I would ask them to step out during this procedure. I perform hand hygiene and give him a face mask and ask him to turn his head away from the site. And I'd apply clean gloves. And this mannequin does not have an old dressing, but we're gonna pretend. So I would take off the old dressing with the clean gloves, being very careful to pull it in the direction of the catheter insertion. And as I'm doing this, I will be assessing for any signs of infection, like any redness, any swelling, any drainage, making sure it's not green or yellow drainage, because that's bad. Then I would take off my clean gloves and perform hand hygiene again. And then I'll get my sterile field ready. So be very careful. Being very careful to touch just the 1-inch border. And during this, I'm going to remain conscious of like my sterile field and not turning my back on it. So now that I am sterile, I'm going to be careful to make sure my hands stay above my waistline, and I'm going to move this so it's out of the way. And then I'm going to get the chlorhexidine treatment. You would crack it and shake it up and make sure the thing is moistened really well. But for instructional purposes, I'm not going to crack it. This will be my dirty hand, and I'll remain conscious of that throughout the entire procedure. So I would grab this with my dirty hand, crack this, and clean in circular motions from the inside to the outside, and be very careful not to bring the after I get to the outside, bring it back in, because that's just reintroducing bacteria and making the area dirty. Then I would clean down the tubing, making sure to clean as best I can, get rid of any blood, any debris, anything like that. And after I get it good and clean, cleaning from the outside, the inside to the outside, then I would drop this, take this and discard it, and get the biofilm out and apply it on the tubing. And then I would get the Tegaderm and put it over it. For instructional purposes, I'm not going to attach it to the mannequin, but I would make sure the little divot here is pointing down and in the direction of the tubing. And I would take off the little initials, date and gauge. You don't write on the patient, and you write your initials, the date you did it, and the time that you did the procedure, and put it on the patient. After that, I would make sure the patient doesn't need anything. I would remove their face mask, make sure that they're comfortable in bed, put the bed in lowest position, give them their call-light, and then I would leave the room and I would document the procedure is done.